So looking at a little bit more, what I was looking at in my thesis was, what are these expectations? What does nursing mean? What is it that people are pushing themselves so hard to try and achieve? And why are they struggling so much with it? And what came through time and again is a word that, again, is very, very familiar within the Chrysalis Effect, is this issue of boundaries. And nursing really is. It's an experience of juggling a role that has no limits, where you're not supposed to have personal boundaries. You're not supposed to say, no, I can't manage that. That's not good for me. You're not allowed to say, that's not my job. But nurses really, really struggle to describe what it is that nursing is. And this is a conversation that's been going on in nursing circles since it began, I think. What is nursing? What counts as the nursing role and what isn't? So that you know when you can say no or not. And as part of this work, I developed a couple of diagrams, and I hope this is not too technical here, but I'll take you through them, to explain how nursing is viewed now and how nurses understand it. So this diagram, the red circle, represents the multidisciplinary teams, so all the people who are working together within health to support the patient back to recovery or to the optimal health that they can achieve if they're not going to recover. And it's very much a kind of silo mentality. So each occupation has its own specialism. So the doctors do diagnosis and treatment of disease, and the counsellors or the psychiatrists deal with mental illness and support. Physiotherapists and the occupational therapists are looking at movement and function. And the pharmacist is dealing with the drugs, and the dietitian is dealing with nutrition. So where in this very common model of understanding roles in a workplace do nurses fit? Because a nurse very often will pick up the information which is diagnostic and take it to the doctor, and then have to play this doctor-nurse game, which we were explicitly taught, so that they can tell the doctor what they think's wrong without the doctor thinking that the nurse is doing the diagnosis. We'll spend hours, particularly on a night shift sometimes, sitting talking to people using counselling skills. In the absence sort of weekends and out of hours, we will carry on with patients' physiotherapy exercises or occupational therapy. So as a nurse, when I was helping somebody to have a bath, I was very much using occupational therapy principles to get them to move in particular ways and to exercise the parts that they needed to as part of that activity of daily living. I was also expected to understand the drugs I was giving. So I needed to know what the drug was, what the side effects were, what was the normal dose. So if I made an error in giving out those drugs, even though I hadn't prescribed them, then I was held accountable. But was I a pharmacist? And the kind of nurses get lost in this, that they're doing a little bit of everybody else's job, but they can't say, what is it that I'm doing as a nurse that makes me a nurse and not a physiotherapist or a doctor? And the other thing in this diagram, I think it really stands out, is that isolation of the patient in the middle, who's having things done to them by all of these different groups. And where is the nurse in this? So based on my interviews with nurses and their understanding of what it was they were trying to achieve and that they were so frustrated about, I put together this diagram. So you still have that red circle, which is the multidisciplinary healthcare team. And you still have all of these different specialisms, but there is now the blue circle of nursing activity, which actually overlaps with all of them. So nurses need to know a little bit of everything, and a lot of them would talk about being a jack of all trades because they're filling the gaps. They would also talk about being a project manager or about the glue or the lubrication that makes things work. And above all, seeing the big picture with the patient in the center of it, making it all happen. And then at the center of this, instead of an isolated patient who's been dehumanized, labeled as a patient, you have the nurse with that patient and with the family. And what nurses were trying to do was to keep those people human within a really dehumanizing situation. So they would get to know those people and they would share what they learnt about them with the rest of the team so that their care could be individualized. But they will also understand the system so that they can interpret for the patient and their family and let them know what's going on and guide and navigate and walk alongside them through their experience of being ill. And so it's a totally different way of understanding quite what it is that you're going to do, and it's very much at odds with the dominant models. And that really was at the heart of the problem that nurses were having. This is what I'm trying to do, and I'm trying to do it in a system that works like a factory that dehumanizes. And it dehumanizes the patient, and it dehumanizes me. If you found this video helpful, please do click on like below and subscribe to my channel. You might also like to hop across using the links to my Facebook or LinkedIn pages where you'll find much more content.